Hi students, it's Professor Bridget again. This is going to be part 2 of the skeletal system lecture, and in this lecture we're learning about the different types of ossification. And remember that ossification is one of the ways in which bone is formed. So these two types of ossification are the ways in which bone is created. So you've got intramembranous ossification and endochondral ossification. So I want you to take a second just to dissect those words because they're pretty big phrases, right? So this one, intramembranous, intra means within. So this means a type of ossification that occurs within a pre-existing membrane. And endochondral is a type of ossification that occurs within cartilage. So the templates or the pre-existing tissues that are converted into bone or cartilage, and in this case it's using the term membrane, but it's dermis. It is dense connective tissue. So you've got these two pre-existing tissues, dense connective tissue and cartilage, that through these processes of ossification then turn into bone. So we're going to look at these processes in pretty great detail. Oftentimes they end up as either essay questions or short answer questions on an exam. So you'll want to know these processes from beginning to end, and I'll do a good job of explaining each one to you. Let's have a look real quick at this picture. If you've started already learning the names and recognizing the shapes of bones, you can see in this 12-week fetus some of the bones that are undergoing ossification. So if we look down here in the lower right-hand corner, all bone in this radiograph is going to be colored red, and cartilage that's destined to become bone has been stained blue. So you can see which bones are developing and where further development will need to happen. So we can just recognize one of these. You're looking at a lateral view. So here's the little nose right here. Here the fetus's lips, right? So down here, that'd be the mandible. You probably already recognize that. And then this bone right here is the temporal bone. It's already taken on its adult shape, although it's going to get bigger. Here's the zygomatic bone, and so on. Okay, so it's just kind of a neat picture to take a look at, because you should be able to, even in a 12-week fetus, recognize the shapes of the bones that you're learning in life. So the way in which I'm going to go through each type of ossification is to read a real quick summary to you, and then we're going to go over it together while we're looking at a picture. So we're essentially going to go through it two different ways. I'm not going to read this to you first, because if I do, this is just not going to make any sense to you, right? So let's look at the picture first, and then we'll come back to the summary, and I'll summarize by looking at the words with you. This is also a good way to study this type of ossification too, because you have the summary written down essentially in steps here for you. So let's look at some of the steps. So this is a process, remember, that occurs during fetal development, and it occurs inside the dermal layer of the skin. That dermal layer is made of dense connective tissue. So that's what we start with. That's our template. But what happens is blood vessels bring mesenchymal cells to that dense connective tissue. And then those mesenchymal cells, they differentiate into osteoblasts. And remember, osteoblasts secrete osteoid fibers and wet concrete, right? So, oops, I said that right here. So those osteoblasts, they lay down that osteoid, and then the blood vessels bring calcium and phosphate salts, and the calcium and phosphate salts calcify the osteoid, turning that wet concrete into hard concrete. And then, as I mentioned, spongy bone is first formed, and then some of that spongy bone gets remodeled into compact. So this is the way in which bones like the sternum are created. The os coxae, those are parts of your hip bones. All the cranial bones and the sesamoid bones are created in that matter. jump ahead to this picture right here. So this is not out of the current textbook that we use, but it's by the same publisher. This is a better series of photos than our publisher, our textbook offers. That's why I'm using this one. So intramembranous ossification begins during fetal development at a point when certain areas of the body, the developing body, are made of just dense connective tissue. You don't need to know if it's dense regular or dense irregular. You can just say dense connective tissue. This type of ossification generally occurs in like flat and irregular bones. So like the bones of the skull, for instance, begin this way. So at some point during fetal development, these areas where these bones will form are just made of dense connective tissue. So that's where we're going to start. We're going to start here at number 1. And what this particular step here, number 1, is showing you is that all of the kind of beige that you see in the background, let me do this with a highlighter. All this kind of beige that you see in the highlighter right here, and the darker beige as well, all of that is dense connective tissue. So that was the first type of tissue present. That's the template tissue that bone is going to form from, or this dense connective tissue is going to be converted to bone through this process of intramembranous ossification. So we begin with that dense connective tissue template, and then what we're going to do is we're going to look and see what types of cells come in to convert this tissue to bone. So what the first types of cells that come in are mesenchymal cells. Remember, mesenchyme are the cells that give rise to all connective tissue cells, including osteoblasts. So what happens is this tissue becomes vascularized. These are blood vessels right here. Becomes vascularized, and those blood vessels carry in these mesenchymal cells. So each one of these little white cells here is a mesenchymal cell. And what will happen over time is those mesenchymal cells eventually differentiate into osteoblasts. And remember that osteoblasts are the cells that lay down the osteoid, that ground substance and fibers. So let's look at step number 2 here. And they kind of advance a little too far. It would have been nice if they had an intermediate step right there, but they don't. So you're still looking at the same tissue, but now in step 2, you see some bone has already been laid down. So let me show you some familiar cells. Again, you've got those mesenchymal cells. Those are more mesenchymal cells. And in the center, what you have, or actually, let's not look at the center yet. Let's look around the edge. These cells right here, those yellow cells, all of those are osteoblasts. The very first mesenchymal cells to differentiate into osteoblasts were located here. And they've now matured into osteocytes, but at one point they were osteoblasts. And when they were osteoblasts, they laid down osteoid in the area immediately surrounding them. Right? So when they were osteoblasts, they laid down that osteoid. But remember, osteoid is kind of the consistency of wet concrete. And through the process of calcification, that osteoid hardens into bone as we know it. So those osteoblasts that came in, they laid down that osteocyte. But then these blood vessels right here, they brought those calcium salts and phosphate salts, right, to the tissue. And then that converted that osteoid to the hard ground substance. So it essentially made that wet concrete into hard concrete. And when that occurs, those osteoblasts, they differentiate then into osteocytes. So they convert into osteocytes. And remember, the only thing that osteocytes do is maintain the immediate area around them. If you think about it, it kind of makes sense. Like if you're an osteoblast right here, and you lay down, we'll write it in blue, you lay down a bunch of osteoid around you, and that's kind of like this wet consistency, right? You can still continue creating fibers and that ground substance, right? You can still continue to secrete osteoid. But once you get calcium and phosphate salts coming in, right? You're going to bring calcium and phosphate salts to that wet osteoid. That's going to harden up that osteoid. And so the osteoblast essentially, as calcification occurs, gets caught up or gets trapped in that in the bone hardening around it. So the osteoblast has nowhere to put more ground substance or nowhere to put more fibers. And it's at this point then that those osteoblasts differentiate into osteocytes, the mature form. So let me erase all of this mumbo jumbo that I just drew on here. And let's have another look at this. Okay, so the very first osteoblasts that had originally come in have now converted themselves to osteocytes because they got stuck in that ground substance calcifying, right? And everything that you see here in blue is brand new osteoid. All this is brand new osteoid that's been laid down by these osteoblasts. So bone advancement and, calcification and bone growth will occur in this direction, away from the osteoblasts. So that if we look at number 3, we get eventually kind of this network of trabeculae, right? Remember those are the pieces that make up spongy bone, the struts of spongy bone, so you get these trabeculae. So these trabeculae start growing into one another, like this one's going to grow towards this one, and they might eventually kind of bridge together and make a whole strut right there. But the way that new osteoid and new bone, therefore, is forming is via these osteoblasts around the edge. And then the osteocytes, because they've gotten hardened in that hard osteoid, all they're able to do now is maintain the surrounding area. And in this type of ossification, spongy bone is the first bone to form. So the first type of bone. So you see that all of this is spongy bone. But over time, what will occur, especially with flat bones, is that the bone becomes remodeled in a process you don't need to know about. But once the bone has nearly finished being created, you'll just have spongy bone in the center, and the remodeling occurs on the outside here. This would be like your 2 pieces of bread. So all this bone right here is compact bone. And then what you have on the inside is the filling of your sandwich, the spongy bone. So through this process, spongy bone is first created, but then some of that spongy bone is remodeled into compact bone. So let's go back to this picture right here. And I made an incorrect statement. This type of ossification does not occur in irregular bones, just those flat bones. Okay, so I apologize, but it's corrected and we can move on. Okay, students, before we move on to the second type of ossification, okay, so the next type of ossification is called endochondral. So remember, endo means within, chond means cartilage. So in this case now we start with a hyaline cartilage template rather than a dense connective tissue template that we started with earlier. Here's a nice summary, but it doesn't include everything I would like you to know. We'll go to the picture first, talk about all of the details, and then we'll come back just to this summary, okay? So our summary right here. So this type of endochondral ossification is what creates our long bones, the femur, the humerus, the radius, the ulna, etc., all the irregular bones, and of course the short bones. So you can see how we were just looking at that process of how the extension or the bone growth towards the epiphyses of that cartilaginous template, how that elongates or creates these long bones. And that's a process that occurs or continues to occur all the way up until you're about 20, 25, something like that. So it begins at like 6 weeks of fetal development and continues all throughout your life up until you're about 25. And so that's when we stop growing. That's the point where we eventually cannot get any taller. Let's go back. So this is the series that your authors provide for you. And let me get my pencil ready. I'll use red first. Nope, not red. Let's use green first. Okay, so we begin with this hyaline cartilage template. And what happens is that cartilage, the cells there, the chondrocytes, they begin to die. They are pre-programmed to grow for a certain period of time, and then they rupture and die. So right here in the center, you see those chondrocytes where they would have been laid down, and you see these ones, they're giving you a couple of examples where they're getting quite large, and that means they're about to rupture. And that process essentially makes way or makes room for osteoblasts to come in and start laying down osteoid. So those chondrocytes near the center of this hyaline cartilage template, they increase in size and then they die. And they essentially disintegrate, leaving these spaces within the cartilage. Now remember, all cartilage is avascular, so it doesn't have a blood supply. But if you look at step 2, what's happening now during development is these blood vessels have come along and they've anchored themselves to the perichondrium. And what they've done is converted this perichondrium here in yellow to periosteum. Well, the way you do that is the blood vessels bring osteoblasts. So the osteoblasts start laying down bone around the outside. And a change that you can see here also is, look, check out the shaft of this long bone. That's starting to grow. Look how much larger that shaft is of the long bone versus over here. So you see that at the same time these blood vessels are coming in, bringing osteoblasts and initiating bone growth, the hyaline cartilage template has grown as well. It's gotten longer on each end, and it's also gotten thicker. So if we move over to step 3, what you see is those same blood vessels that initially brought osteoblasts and converted the perichondrium to periosteum have made their way deeper into the shaft. And those blood vessels have, of course, brought osteoblasts. So everything that you see here in yellow is brand new calcified osteoid. So those osteoblasts came in, they laid down osteoid, and then that osteoid was calcified. And that's what you see there in yellow. So that's brand new bone. Again, you see the enlargement of the hyaline cartilage template as a whole. So that's continuing to get bigger. And at the same time, you see more chondrocytes getting larger, and they are going to rupture and die and make room for bone growth to occur towards the epiphyses. So hang on just a second. So what you see here is that these blood vessels have branched, and now they're moving out towards the epiphyses, right? And those blood vessels are bringing osteoblasts. Osteoblasts are laying down osteoid. Osteoid then becomes calcified. And this is the process of growing and elongating this bone. You might be asking, well, how come this hyaline cartilage template keeps growing? What the authors are not showing you here is that at the epiphyses, especially right at this line right here, on both sides, right at this line, and up here, you've got chondroblasts that are continuing to grow cartilage. So that's why the whole cartilaginous template continues to grow in towards the epiphyses and get bigger, longer and wider, because you've got chondroblasts laying down cartilage. Even though these chondrocytes right here, they're dying, these big ones are dying, there's a row of chondroblasts, especially right here, but all over in the epiphysis, that continue to grow that cartilage and extend the length of that cartilage, and also increase the width of that cartilage. So that's how the whole thing is, the whole template is growing while we're still making bone. Okay, so let me erase this here real quick. Let me just define a term for you. That first area in the center of the shaft where bone is created, that's what we refer to as the primary ossification center. So those blood vessels come in, they bring osteoblasts. Osteoblasts lay down osteoid. The osteoid becomes calcified, and then you get what's called the primary ossification center, the first center of ossification. We can move on over to number 4 right here. And again, you see the whole hyaline cartilage template has gotten larger, but you also see some other differences too that are pretty obvious. So here's that primary center of ossification in the middle, right here, right? That's where ossification began. But now one of the things that you see is that there's a space here. That's the beginnings of the medullary cavity. And the way that is formed is via osteoclasts. So osteoclasts were brought in to break down some of that bone that was first formed to create that medullary cavity. You can see that the blood vessels that you see here in red are getting, they're branching much more, and they are continuing towards those epiphyses, right? So as they do, they're bringing more osteoblasts, more osteoclasts, and you see also that the template has gotten larger and thicker. So this area here, this epiphysis has gotten larger and wider, so has this epiphysis. But one of the neat things you also can really see now is this line of advancing bone versus advancing cartilage. So I'll just erase this right here and I'll show you what I mean. Okay, so in yellow right here, you've got bone, right? So that's established bone, that's calcified, I mean that's mature, like calcified bone, right? Right here, you've got a layer of osteoblasts, and osteoblasts are doing their best to lay down osteoid. But remember what makes up these epiphyses. There's gonna be a line of chondrocytes here that are very quickly, I'll just draw on chondroblasts, draw on some chondroblasts that are constantly laying cartilage down and advancing the cartilage in this direction. But at the same time, you've got osteoblasts in here that are laying down bone. So it's almost like those osteoblasts are chasing those chondroblasts. And as those osteoblasts advance and that osteoid gets calcified, you get bone growth towards the epiphysis. You'll still have chondroblasts up here laying down new cartilage, and that will advance the cartilage in this direction, right? But right behind that, you've got osteoblasts that are trying to keep the pace with these chondroblasts. So at some point, you'll have all of what was once cartilage here, all of that will eventually be turned into bone through this process. The cartilage will continue to grow, right? And so you see this advancing bone in this direction. The same thing occurs towards the other epiphysis. So you can see how bones get longer through this process. Okay, so let's go through real quick. What will eventually happen is, oh, I made a mess out of this. Let me erase some of this. What will eventually happen, especially once you hit puberty, is that this area of bone growth right here will start to speed up, and it will start to grow much faster than the chondroblast can lay down cartilage, and then eventually all of this will become bone. Okay, so let's go ahead and look at the next picture too. That will show you just a different view of how this process occurs, where you have this hyaline cartilage template that you begin with, and Eventually, blood vessels come in and they turn that perichondrium to periosteum. You see the chondrocytes enlarging and rupturing to make way for osteoblasts. You see blood vessel coming in here. That blood vessel is going to bring those osteoblasts and then lay down new osteoid. That osteoid gets calcified. You see something else happening here too that I didn't mention on the previous picture because it wasn't shown. As this bone starts growing in length, you'll also have blood vessels come in at the epiphyses, like right here and right here. And those blood vessels will bring in osteoblasts that start laying down osteoid at the epiphyses. And that osteoid, when it's calcified at the epiphyses, becomes what we call the secondary center of ossification, because it's the second place where ossification begins. And then, again, you see this long bone growing in length. And eventually, what will happen is this area, these areas here that you see in blue, that's cartilage that's still growing and lengthening the bone itself. But eventually what will happen is the osteoblasts are going to lay down osteoid faster than the chondroblast can grow. And so those areas that were filled with cartilage now get completely filled in with bone. And it's at that point bone can no longer grow in length. And this is when you're finished growing, you're done. So many of you may have gone to a doctor sometime when you were a teenager and for some reason maybe had an x-ray and the doctor said, okay, well, I can tell by what your bones look like that you're going to be, 5 feet 11 inches tall. The way they did that was they looked at the amount of cartilage that you still had left to fill in, and they're able to determine using an algorithm, they're able to determine about how much more cartilage will grow, and therefore how long your limbs will be, and therefore how tall you might be. Okay, students, so those are the two different types of ossification, the ways in which bones grow during fetal development. And earlier in this slide, or maybe a previous slide, I had mentioned the name of this region of a bone right here, and I'm going to name it again. I'm going to talk about it again. I paused recording this lecture for about 12 hours and I can't totally remember where I left off. So if I'm repeating myself, not a big deal. Better for you guys anyways, I guess. So let me get back started here. All right, remember this region between the epiphysis and the metaphysis. In a growing long bone, that is called the epiphyseal plate, or you can call it the metaphysis. And that's a region of the growing bone that remains cartilage. You guys might know it as a growth plate. So I'm sure I said this just a few minutes ago, but I just want to make sure that you guys recognize that that's what it is, because on the next slide, we can actually see these. We can see over on the left is a young adult who's still growing, and then a mature adult over on the right. And this is an x-ray of the left knee over time. This bone up on top would be the femur, your thigh bone. This down here is the tibia, and this space right here, although it appears empty, that's the joint capsule. That's going to be filled with fluid. Everything that you see, and this is how x-rays work really, everything that you see in a light or a white color is very dense tissue, so in this case that would be bone. Anything that appears grayish or black is either a fluid-filled space or a soft tissue space, like cartilage. So in this picture, you can easily see that there's this break here. That would be that hyaline cartilage between the diaphysis and the epiphysis of the femur. So you can tell that that's the growth plate. And so this individual has more growing to do. And you can see it right here too. And if we zoom in, even easier to see, right? So that would be able to tell a physician or a forensic pathologist, somebody investigating a crime, if they had a set of bones and they took an x-ray of them, they would be able to tell that the individual was not yet finished growing, and so likely then could estimate an age under 25, or again, being able to tell somebody that they'll still be able to grow a few more inches or what have you. Over on the right, you see that those spaces, those growth plates, those epiphyseal plates have disappeared, and what they leave behind is a line. So you can almost see that white scar here. That's the epiphyseal line. So that's where the epiphysis of the femur has grown into the diaphysis of the femur. So you get this line where the bones have grown together. Neat, huh? Okay, so last here we're going to talk about is injury and repair. So we learn about how bones grow during fetal development, but what happens when they are broken or injured? I know this is a pretty gnarly break right there. That is a break of the distal tibia and fibula, which is a pretty serious break. Not easy to do, but in sports, sometimes those things happen. So your book does a pretty good job of explaining how repair occurs in this stepwise process. They're showing you a humerus, your upper arm bone, and then going through the steps, they show you how those bones react once fractured, and then how the healing process occurs. So remember that bone is really well vascularized, and the blood vessels that travel within bone travel up those central canals of osteons. Bones have to be well vascularized. They're living tissue, right? So when a fracture occurs, blood vessels are going to break, and you're going to have a little bit of bleeding. And so that's what this kind of horror movie, dripping blood part of that picture is supposed to show you. But over time, a blood clot will form. So imagine, I'll just draw it in black. Let's just imagine like a blood clot forming here and slowing down that bleeding. And then that blood clot will grow. And so eventually you'll have a huge clot. I shouldn't say huge, a larger clot that we refer to as a fracture hematoma. So temporarily blood flow is stopped. The clot kind of serves the purpose of the body going, oh, okay, let's stay calm, let's stop the bleeding first, and initiate the repair process. And that repair process is going to include restoring blood flow to that region, because the blood is going to bring nutrients and oxygen and more osteoblasts to the site for repair. But temporarily, a clot forms just so we can stop the bleeding. That would be the immediate threat, right? And then repair will begin. And this is going to vary depending on your age. Kids are going to repair themselves so much more easily than, or I shouldn't say easily, quickly than adults, because they still have really active osteoblasts because they're still growing. As adults, your osteoblast activity, especially if you're a woman, decreases dramatically after the age of about 35. So after the age of 35, when you have a bone fracture, you're going to take a whole lot longer to heal. But nonetheless, we all do it. We're just going to do it in different time scales. So let's look at step number 2. With step number 2, over time, and the amount of time that this takes is going to vary from person to person depending on age and health, right? So keep in mind those variations. We're just talking about the generic here. Over time, you get an internal callus that forms, and that's going to be made out of hyaline cartilage right here. And so that's going to be kind of like a temporary band-aid holding the bones together. But remember, tissue has to exist before it can be converted into bone or into osseous tissue, right? So the cartilage callus forms first, and then gradually what you get is ossification of that cartilage that you see here in yellow and where I'm drawing the green dots. Eventually, all of that internal callus will be turned to bone, and that's what you see in the next picture. On the inside, oh sorry, this is the external callus on the outside right here. And then you get an internal callus and that's going to be made of bone too. So this is usually, or this shows you just why immobilizing a bone is so important, because while this bone is healing, if there's any shift in the upper portion or the lower portion, this is all just spongy bone that first forms. It's going to be really delicate. So if you immobilize the site of the fracture, then you prevent the new bone from breaking as quick as it's formed. Again, over some period of time, you're going to get near complete ossification of that internal and external callus. So all of this that I'm highlighting here in yellow, all of that. You get some repair here in those last few spaces, but all of this is bone, and it's getting thicker now. It's not just spongy bone, it's getting remodeled into compact bone. So all of that will eventually completely solidify, making that site of fracture actually the strongest part of the bone now, because it's all brand new bone. And then over time, or for some period of time afterwards, you'll still have this bump on the bone, this external callus, because the remodeling process or the repair process of bone isn't perfect. And so the important thing is just to get a whole bunch of new bone laid down there to stabilize the bone, right? So you're going to have at least a bump for some period of time that's made of bone, made of osseous tissue, and we call that an external callus. These can sometimes be really important or good pieces of clinical clues, I guess you can say. Imagine, could be anybody, could be a wife, any woman goes to the doctor for some condition unrelated to a fracture. The doctor decides, well, we should x-ray this area, we need to look for such and such. And on the x-ray, the doctor sees that there's a callus on the arm. And let's say the woman went in and she's complaining about pain in her skull or her head, right? He may then be able to begin a line of questioning with the woman or anybody. It could be somebody elderly. It could be a kid. Hey, did you break your arm? I didn't know you broke your arm. That's not in the chart. There have been many cases of child abuse and elder abuse detected when an individual goes in to get an x-ray for something unrelated to what the doctor actually finds. So kids perhaps who don't know how to speak yet, or are too afraid to speak up, may have on an external callus show up on an x-ray that was a result of abuse earlier in the child's life. The same thing with elderly adults. We know that elder abuse occurs too. So this is the repair process, but also the result for some period of time will be that external callus, which is can be a really good piece of information clinically anyways. Okay. And then lastly, for part 2 of the skeletal system lecture, I've kind of already alluded to this as we've gone along, but remember that bones are living tissue, and bones are constantly growing, being damaged, and repairing themselves or remodeling themselves. So every year, about 20% of your skeletal system is broken down. And so maybe remember, but I'll tell you again, the cells that break down old bone, remember those are called osteoclasts. So osteoclasts are doing their job of breaking down old or damaged bone, and the cells that are responsible for making new bone, remember, are osteoblasts. So they're the cells that are responsible for replacing that old and or damaged bone. And that's just through natural processes. This occurs throughout our entire lives. It occurs more quickly when we're younger, a whole lot more slowly as we age, right? The activity, or how fast these osteoclasts and osteoblasts are doing their job, one of the things that affects their activity rate is physical activity. So getting some exercise will, exercising, especially weight-bearing exercises, increases osteoblast activity. So this is why weight-bearing exercise is so important as you age. and then also the balance of certain hormones. We will, in the next lecture for skeletal system, talk about the importance of estrogen and its role in osteoblast activity. Estrogen is a hormone in general. It speeds up the rate at which cells do their jobs. And so the higher the amount of estrogen, the greater activity in osteoblasts. So as you're a teen, for instance, as you're aging as a teen, and estrogen starts to increase because you're a teenager, and that's what hormones do, they increase. That increases osteoblast activity, and so you often see growth spurts. You see teens grow a significant amount between perhaps the age of like 12 and 18 or whatever you, and that's as a result of the balance of hormones. Okay, primarily estrogen in that case. We'll talk more about it as with regards to aging in the next lecture. Okay, so this is the end of part 2 for the skeletal system lecture. There will be one more part 3 that I'll post soon also.